Views, opinions, and content of this show are those of the host, guests, and callers. They do not necessarily reflect those of Local Matters Broadcasting, LLC, its owners, partners, affiliates, assigns, or heirs. Having said that, it's now time to say good morning, St. Johns County. Welcome to the first day of May, and welcome to the weekly radio show of the St. Johns County Council on Aging, better known in our community as the COA. We are your local nonprofit agency who for the past 51 years has been leading and advocating for the dignity, independence, health, and community involvement of older St. Johns County residents. I'm Brian Robinson, Program Director for COA, broadcasting to you live from the studio of WFOY 102.1 FM, your local radio station for news, sports, and talk. Before we get into our show, let me remind each of you that if you have a question, comment, a suggestion for a radio show topic, or if you have a question during today's show, you can send that by email to radio@coasjc.org. Again, that's radio@coasjc.org. Well, it is hard to believe that we are already in the month of May. And for anyone who is unaware, May is Mental Health Awareness Month. Since its inception in 1949, Mental Health Awareness Month has been a cornerstone of addressing the challenges faced by millions of Americans living with mental health conditions. This morning, I am joined by Nangy Pulsfus, CEO of Epic Behavioral Healthcare. Before becoming the CEO of Epic Behavioral Healthcare, Nangy spent many years of her career at Flagler Hospital before becoming the CEO of Epic Behavioral Healthcare in January of 2024. Nangy, welcome to the show.
Thank you for having me, Brian.
Good to have you on here. Thank you for taking time out of your busy schedule to be with us and to start your morning off with us. So Epic and Council on Aging both became incorporated entities in 1973. Both of our organizations are also registered nonprofits. But even with such a long history in our community, I still encounter people who know very little about what we do at COA. So educating the community about our programs and services is extremely important. So with that said, would you be kind enough to educate our listeners on Epic Behavioral Healthcare? Who are you? Where are you? What services do you provide to St. Johns County residents?
Absolutely. So Epic began in 1973 as the Jam House. From the beginning, we had a focus on substance use and mental health disorders, offering treatment and prevention services. We currently have 4 locations in St. Johns County and 1 location in Flagler County, 4 outpatient treatment clinics and 1 inpatient detox residential treatment facility, and also 2 sober living homes that will soon turn into a village of 8.
Wow.
Substance use outpatient and inpatient treatment programs, mental health outpatient treatment programs, crisis services, including a walk-in access center, mobile crisis response team, and a co-response team, partnering with the St. John Sheriff's Office. We have a MARS clinic offering medication-assisted treatment, hospital bridge program with Flagler Hospital and Ascension, services in the jails including SITE, JET, and SMART programs, drug and veterans court, suicide prevention training programs, prevention programs for adolescents and adults.
That's fantastic. And I love you sharing all of that because do you find that to be the case? Like I find that to be the case when I'm out in the community and talking about COA, that there are, some people have never heard of us, but some have, but they don't know the extent of all that we do. Do you find that to be the case?
I absolutely do, which is surprising after 50 years in the community.
Right, exactly.
And when we say Epic, they think, is that the movie theater?
Well, yes, that's true. And then there's also another organization called Epic Cure.
Epic Cure.
Right. Mm-hmm. And so people probably get confused with that as well. Yeah.
They do.
Yeah. Well, it is. I'm just amazed at all that you do, and that's why I wanted to have you come on the show and just talk about all the different services that you provide, and then the focus on the topic of mental health. So one of the things that's coming up, Epic is going to be serving as a primary behavioral health provider at the West Augustine Health and Wellness Center, which is being constructed at 938 West King Street. So in this first session, a segment that we're on the radio, what is the progress of that construction, and can you provide some more details on the services that will be provided there?
Yes, absolutely. So construction's well on its way. I believe that it should be completed by the end of this year. So we will probably move in sometime January, early 2026. Very excited about that, to serve that community right there close access to care. And another part of this is we're really going to be moving into integrated care. So we're going to partner with the Wildflower Clinic. We'll offer the substance use disorder treatment and mental health treatment with nurse practitioners for psychiatry, as well as clinicians and prevention focus for our adolescents. And then Wildflower will provide the primary care and specialty care, all in one location. And why that's important, Brian, very often, and I think we'll be talking about this, the social stigma. With mental health and substance use, people shy away from seeking treatment because they don't want to be frowned upon, if you will. So with this clinic, people sitting in the lobby waiting to be served, you won't know, nobody will know if you're there for substance use, mental health, or just to see primary care for hypertension. So we're hoping that'll break down those barriers and people will seek care.
Oh, that's fantastic. Now, so will Wildflower still have their current location? They
will, and they've outgrown that location, so their dental services will stay at that location, but a lot of the specialties will move into the office space with us.
Well, that's very exciting.
I think so,
I'm
too.
excited for you and for Wildflower to be joining you, and I think that's great. One of the things that I love about St. Johns County is just the collaboration that goes on, right? And we've been at similar meetings where, you know, a variety of different organizations and businesses come together and just try to see how we can collaborate together to serve the people of St. Johns County. So I'd love to hear that you'll be collaborating with Wildflower, and just looking forward to seeing that take place.
Me too.
Yeah, that's great. All right, well, we're going to go ahead. I got a lot of other questions for Nangy, but we're going to go ahead and take our first break right now. And you're listening to the weekly radio show, the St. Johns County Council on Aging, and we'll be right back after these messages. And welcome back to the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA. Joined this morning by Nangy Pulsfus, the CEO of Epic Behavioral Health Care. And I was talking in the first segment of the show that May is Mental Health Awareness Month, and so I wanted to have Nangy on our show to discuss the importance of taking care of your mental health. This topic is near and dear to my heart because I personally have dealt with depression since I was a teenager. I did not seek any help until my mid-30s when my depression was at its worst, and my doctor diagnosed me with major depressive disorder. And the reason that I did not seek help prior to that was because of the stigma that is prevalent in our society regarding mental health. So my question, Nangy, is you've been in the medical field now over 30 years. Do you find more people are willing to seek help today than they did 30 years ago?
Yeah, Brian, I do believe that there's still stigma, but many people in today's time recognize that mental health is part of a person's overall health and well-being. And more people are willing to seek help today. Ironically, COVID did help break down some of the barriers around seeking help for mental health, and it did help to lower the stigma.
Mm-hmm. Wow, that's great. I think back, I was a teenager in the 80s, right? And that's when I first started having, looking back on my life, right? That was when I was first started having thoughts of suicide. It was, probably 13, 14 years old. But I kept that to myself. And again, I didn't. And then, tied into that, then later in life, I felt a call to ministry. And so I was in ministry for a number of years. And so then that kind of added an extra stigma to it, right? Because here I am as a pastor, I'm standing up and I'm preaching a sermon, and I'm talking about, you just need God, and God is, God can help you in everything, and, just trying to motivate people and so forth. But yet I was still struggling internally, right, mentally, with my depression, off and on, not a constant thing. So even with that, there was that extra part of stigma that kept me from getting help. And so I'm so thankful for places like what you do and your organization and the services that you provide. And I'm so thankful that, we have things like Mental Health Awareness Month, right? And I'm trying to do my part now, I'm 52, to just be an advocate and just say it's okay to not be okay. right?
Absolutely.
Okay, so the other thing is this, it's not considered a clinical diagnosis, but my doctor labeled me as someone with high functioning depression. So I did a little bit of research on what that means, and so according to the National Alliance on Mental Illness, this refers to anyone who is grappling with depressive symptoms while accomplishing their day-to-day tasks and upholding their responsibilities. And so I say this because I feel it's important for people to realize that depression can affect people differently. With this being the case, what are some signs, if you would share with us today, what are some signs people should look for in themselves or in those they love that point towards depression?
Sure. So symptoms can include feeling of sadness and tearfulness, angry outburst, irritability or frustration, even over small matters, loss of interest or pleasure in most or all normal activities, sleep disturbances, including insomnia or sleeping too much, tiredness, lack of energy, even small tasks take extra effort, reduced appetite, weight loss, or increased cravings for food and weight gain, anxiety, agitation, and restlessness, slowed thinking, speaking, or body movements, trouble concentrating and making decisions and remembering things, unexplained physical problems such as back pain or headaches, feeling suicidal thoughts or attempting suicide. And we often see people are withdrawing from those that they love.
Mm-hmm.
Missing work.
Mm-hmm.
All could be signs of depression.
Yeah. So, if you're out there listening today and you hear what Nangy's describing, and maybe you think that's describing you, or maybe you're thinking of somebody that you love and it's describing them. The next step would be to talk with your doctor about it, right? That was the first step that I took, was finally to talk with my doctor about it and say, hey, this is what I'm feeling, and it's been going on for a long time. And then your doctor is going to probably ask you some different questions, to get a better idea, a better understanding of what's going on, and then of course point you in the right direction to where you can get even more specialized help and assistance from those who have that training, right? Because your regular doctor is not going to have that type of training, specialized training. And so if you're out there listening, you've heard some of these descriptions, and you need help, reach out, talk to your doctor. It is okay to not be okay and to seek help, to get help. I did that, and it was a long journey for me to get better, and it is still something that I struggle with from time to time, but I would say 95% of the time I'm doing well. There's still that 5% of the time that my depression kicks back in and I struggle with it, but it's been a long journey to get where I'm at. But there are people out there who want to help, and there's things that you have to do as well, right? So I had to do my part, right? I had to take the medication that they told me to take. I had to participate in counseling. I had to what really benefited me was to exercise more and start eating healthier. Once I moved here into Florida, that really helped because I was able to be out in the sun more. And then the current doctor that I see, eventually initially he ran a lot of blood work and saw that my vitamins, a lot of my vitamins, I was deficient with B12 and D. And so just getting those back up where they need to be. So just a lot of things that come into play to get you to that point. So do seek help. Do seek help. That's the whole point of this show this morning, is to let you know that places like Epic Behavioral Health Care and the people who are there, they care about you and want to help you. All right. We'll probably get interrupted by a commercial here in just a few minutes, but one of the challenges that I discovered when I sought counseling in West Virginia, which is where I was living at the time I was diagnosed with major depressive disorder, was affordability for counseling services. I was in the lower income bracket at that time, and the $60 copay was not affordable to me, especially when a therapist wanted to see me every week. So does Epic provide counseling services to those who cannot afford it?
Yes, we absolutely do, Brian, and this is an important point. We work with clients to determine if they're eligible for insurance because, of course, very often they have more than mental health or substance use disorder. They need to see primary care as well. So we have care coordinators that help them gain insurance, as well as other social determinants of health, to see if they're eligible for Medicaid or commercial. However, we do not turn anyone away due to lack of funds. So we do a lot of fundraising, and we do apply for many grants, like you and I were talking about earlier, to help fund those who just can't afford to seek services. So anyone who walks in our doors, unless they need a higher level of care, we absolutely serve them.
Do you have a lot of homeless population that seek your services?
We do. We do.
And you're able to serve some of them?
All of them.
All of them. That's great.
All of them. Particularly in our detox and residential program. I would say very often 50% of those coming to us are homeless. And the really nice thing about that, however, is during their time with us, again, care coordinators work with them, they leave to a house. And it's very often our sober living homes, and they can live there for up to a year. We help them get a job, vocational training. We teach them life skills, coping skills. We help them with transportation, which is often an electric bike, because many of them don't have a driver's license any longer. It's been pulled. So it's really nice to see after a year they transition into their own apartment and have a good, sustainable, healthy life.
Yeah. So kind of impromptu question here. Can you think of someone that's a success story without mentioning their name?
Oh, absolutely. In fact, he speaks for us often in the public because he's so excited. So he's been sober for 5 years now. It took him 23 tries.
Wow.
He was homeless and he didn't have a job. But after the 23rd time, he made it successfully, and he went through our programs all the way through sober living. He's been employed now and sober for 5 years. He's healthy. He looks great, and he's happy.
That's great.
Yeah.
Oh, I love that.
Yeah.
My dad was an alcoholic and struggled with that his whole life. Now, by the time I came along, I'm the youngest of 5. By the time I came along, he had it very well under control. I mean, he went to AA meetings and was sober. There were times every once in a while that he might have a setback. But so I've seen firsthand the struggles that come with that, and when I can hear, and he was he rose above it, and he ended up being a community leader, and him and a group of men built this wonderful baseball field in Weirton, West Virginia from T-ball all the way up through senior league, and then he was involved in politics, and so he rose above it and accomplished great things. And so I always love to hear success stories, and I'm glad that has worked out and that individual is out speaking on behalf of your organization. All right, so we're about to go to our next commercial break. I got some other questions for Nangy when we come back. You're listening to the weekly radio show of the St. Johns County Council on Aging. We'll be back after these messages. And welcome back to the weekly radio show of the St. Johns County Council on Aging here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined this morning by Nangy Pulsfus, CEO of Epic Behavioral Healthcare. And during our show, we've been talking about Epic Behavioral Healthcare, different services that you provide, and then we've also been highlighting the fact that May is Mental Health Awareness Month, and I've been sharing my personal story on the air with all of you. All right, my next question, sorry about that, I had to find what I do with my list of questions. My next question, our target audience for our radio show is people who are 60 years of age or older. Individuals in this age group often find themselves taking on the role of a caregiver, and caregiving is physically, emotionally, and mentally exhausting. And before I ask my next part of the question, I just want to state that, and I know that personally because my wife and I took care of her parents for 3.5 years, and before they both passed away, her dad had a brain aneurysm rupture and was paralyzed on his left side. 6 months after that, her mother got diagnosed with breast cancer, and so we took care of them until they passed away. And it is very, very exhausting to be a caregiver. And for reference to my wife's dad, we had to bathe him, we had to help him use the bathroom, we had to feed him. It was basically like taking care of a 200-pound baby. And so it is very exhausting. And so does Epic provide any specialized mental health counseling for caregivers?
Yes, we do. So our clinicians stand ready to help support caretakers or caregivers and provide a safe place for them to vent, share their fears, their frustrations, sometimes anger and sadness, and other emotional aspects of being a caretaker.
Yeah, and I think I love that you bring out the fact of venting, right? There's nothing wrong with venting. You just got to be careful who you vent to, right?
That's right.
But that's what I love about, so we have caregiver support groups at Council on Aging, and we have Paulette Kozlowski who oversees that, and she does one-on-one with caregivers, but then she also does support groups. And one of the things, and I've sat in on some of this, and one of the things that I love about the support groups is folks can just come and kind of let their guard down and share what's going on, how they're feeling about it, and like you said, just vent. And that is therapeutic in and of itself, to just get some things off of your chest, but also then to hear other caregivers share their frustrations, right? So it helps you to feel, oh my gosh, it's okay if I'm feeling this way. Because I think a lot of times you feel guilty as a caregiver to start having these feelings, right? Because in caregiving, in my personal experience, it was like taking care of a 200-pound baby. And so her father, now again, my wife did most of it, right? I'm not going to take a lot of credit for this, but I helped as I could. But the person demands a lot of your time, just like a baby does, right? And so you can get to a point where you start feeling resentment towards this person, because now your life is revolving around taking care of this person. So, and it's okay to have those feelings, and it's good to get those feelings out, and it's good to know that other people feel that way. And so I'm glad that that's something that you offer there at Epic.
Yeah, and we're also working towards having our own support groups as well for caretakers. Brian, that should come about in the next couple of months. And the nice part of that is it'll be led by a clinician, a counselor, and we are going to partner with another agency that will actually send somebody to the home to relieve the caretaker, so they can come in person and have some time to just themselves, which we're really excited about.
Oh, that's very exciting.
It is exciting. And I just want to add, because historically we didn't have Medicare Part B, but now we are credentialed in Medicare Part B.
Congratulations.
So those who are seeking services, we can accept their Medicare.
Okay, I know when we spoke not too long ago that you were in the process of trying to get that, and so I'm glad to hear that came through.
It was a year-long process, but we did it.
Oh, congratulations. So you'll be able to help a lot more people now.
Absolutely.
Oh, that's great. And I love that. I love your plan to have a support group, but then have somebody to be able to go and be with that loved one, so that you know that person is being taken care of. And that was another struggle for us as we were taking care of my wife's parents. It was hard for us to get out of the home and go do things. And our kids were still little. So, I mean, we were still raising our children. And so at the time, we were involved in a really great church and what they called small groups, which was a small group of people from the church that you kind of got together with once a week and just kind of did life together. But they would come out every once in a while and sit with her parents so that we could go do something. And that made a huge difference. At COA, we call it respite for the caregiver, and so we have our adult daycare program that folks can bring their loved one to, and then that gives the caregiver what we call respite, so they can go and do whatever they need to do. Right? Maybe they need to go run some errands. Maybe they need to go make a doctor's appointment. Maybe they just want to go get their hair done, or just go home and take a nap. Like whatever, it gives them that free time that everybody needs to have. Right?
That's a great program, Brian. I've seen that. I've visited several times.
We
it's
love
awesome.
it, and it's just great to see the impact that we're able to have on families and make a difference in their lives. As program director for COA, the way I look at my position is it's my opportunity to give back to the generation that raised my generation, right?
Yes.
Now, we serve people 60 and older, so technically, I mean, the folks in the 60s would kind of be like my siblings, right? Sibling age, right? But I think about the older folks who are really in the age of my parents, and that generation raised my generation. And so it's just great to be able to give back to them and to help play a small role in making their lives at this stage of their life as best as possible. And so I count it an honor to serve as the program director for COA. All right, I'm going to jump into my next question here. We might get interrupted by a commercial. In 2023, there were 3,558 suicides reported in the state of Florida. Of those, 46 occurred in St. Johns County. 19 of those were individuals 60 years of age or older. I'm wondering, what are some preventative measures family members can do to help their elderly loved one avoid getting to the point that they no longer want to live?
Yeah, I immediately think of loneliness. So many elderly are living alone and isolated from their families because, with urban sprawl, they live in other states. They often feel isolated and alone, and that can lead to suicidal feelings. Helping them feel connected can help. If they can be involved in social activities in the community, church, neighborhood, family, that can help people feel well connected. Volunteering can help. Connecting them with online groups such as prayer groups, appropriate chat rooms, etc., can offer the social interaction that they are missing. In terms of knowing what to look for if someone is suicidal, we offer at EPIC several suicide prevention trainings that can help people learn of the warning signs of suicide. If someone sees warning signs in the elderly, we have classes that also provide guidance on the next steps to take.
Oh, that's great. So can anybody partake of the training?
Yes.
Okay.
Anybody can, and we do it both in person as well as online.
Mm-hmm. And that's a great point that you bring up. And I'm looking at our clock here. We're about to go to our next commercial break, so we'll continue talking about this when we come back from our commercial break. You're listening to the Weekly Radio Show, the St. Johns County Council on Aging. We'll be right back. And welcome back to the Weekly Radio Show, the St. Johns County Council on Aging, here on WFOY 102.1 FM. Your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined today by Nangy Pulsfus, the CEO of Epic Behavioral Healthcare. Before I forget, next week we will have Development Manager Amy Robinson with us in the studio as we'll be promoting Giving Day 2025. So tune in next week, same place, same time, right here on WFOY 102.1 FM. At the beginning of that show, we'll have with us Will Aguilar, who will talk a little bit more about Giving Day. Giving Day will be in the midst of it at that time when we're on the radio, because it starts at noon on May 7th and runs through noon May 8th. That is your opportunity to give to organizations in St. Johns County that are serving people of St. Johns County. So that includes Council on Aging, and that includes Epic Behavioral Healthcare. So if you're out there listening and you want to support our organizations, we certainly would welcome your donation to do that, because one of the things is we do receive federal, state, county funding. We do receive grants, but that covers about 67% of what we do. The rest is covered by donations. And so we'll be talking more about that next week. Kind of a similar situation to Epic. You get some funding from federal, state, county, and then depend on donations, correct? We do.
We're about a little over 70% reliant on grant funding, donations. We do fundraising as well. Yeah.
And so it's important, because then that allows you to provide more services for folks, right? And then you especially think of, as you were talking about, the homeless population. They're homeless. They don't have an income. They can't pay for the services. And so the donations that come in, I assume, then cover the cost of that.
Absolutely. Yeah. Kind of similarly, Brian, is the work that we do with the sheriff's office and the jail system. In our specialty courts for diverting folks from being incarcerated, that really saves money for the county as well as the state in the long run. So super important that we try to divert. And I have to give a shout out for Sheriff Robbie Hardwick, because he's a big advocate of that, and he's really done a great job.
Yeah. And he serves on our board, and we're very fortunate to have him serving on our board. And I can't say enough good things either about our sheriff and the collaboration that he has with our organizations like yours. And, the fact that you have a team that goes out in a situation to try to de-escalate the situation, right? Because a lot of our officers, they're not trained in that that specialized service. And so you having somebody on staff that is riding around in one of the cruisers and goes to that situation to try to assess it and see if they can de-escalate what is going on. Can you talk a little bit more about that?
Absolutely. So that's our co-response team, and we're actually developing a second team. Highly effective. It's a clinician, a master's level clinician that's riding with an officer, and they're dispatched to a scene where someone might be suicidal or might be escalating with threatening, and they divert, I would say, probably north of 95% of unnecessary Baker Acts and incarceration by de-escalating. Sometimes they're with them for 2 hours or more. So highly effective, and we get weekly reports, and you can see the trends on unnecessary Baker Acts declining since the inception of this program.
Yeah, that's fantastic. For somebody listening that's not familiar with the Baker Act, could you just give a brief synopsis of what happens in that situation?
Yeah, so if somebody is a harm to themselves or others, they can be involuntarily admitted to the hospital to seek services, psychiatric services.
Mm-hmm. Yeah, and so to be able to avoid that situation, if at all possible, is really a better situation.
It is. It is. It's very scary to have an involuntary admission into a behavioral health unit. What we do with the co-response team is we de-escalate them and then immediately get them connected with outpatient services to get them healthy.
That's great. Well, one of my other questions that I have that I want to make sure that we get in before our time runs out on us is what's called the 988 hotline number. And so, similar to 911, if someone is experiencing a situation, a mental health situation, they can dial 988 instead. So I was wondering if you would tell our listeners a little bit more about that, because I feel like there's still some people out there that don't know that exists.
Right. Yeah. So 988 is specifically for those who might be having suicidal thoughts and ideations. They can call, and somebody will help walk them through and get them connected with somebody to help. We have a mobile response team in addition to our co-response team, and the mobile response team will actually go to that individual and help them. After hours, if they call, the 988 dispatcher will often get them connected with our 24/7 services at our recovery center.
And so, and then it's all confidential. I mean, it's not like, people are going to know if you've called 988. They're not going to know that you called it, right?
That's exactly right. Yeah. Mental health treatment and substance use treatment is very HIPAA compliant, very protected.
Mm-hmm. Yeah, that's great. So if you're out there listening this morning, and maybe you are dealing with suicidal thoughts, maybe you're at a point in your life where you're at the lowest point right now, you can call 988, and you will have the opportunity to speak with somebody who wants to talk to you and wants to help you and get you the help that you need. So do not hesitate, because we want you here. We want you to be a part of our community, and we want you to get the help that you need so that you can get better. And that is the point of 988. And that is the point of all that you're doing there at Epic Behavioral Health Care.
Yes, absolutely.
Helping people get better so that they can have a better quality of life. Again, I think back to the story that you shared about the individual who, after 23 tries, finally got sober and has been sober for 5 years. So maybe you're out there and you've kind of in a similar situation. You've given it a try, it didn't work. You've given it a try, it didn't work. Given it a try, it didn't work. And you're at the point like you're just like, why try again? Because maybe the next time will work.
That's right. We often say relapse is just part of recovery. There is always hope.
Yeah, and so and it's nothing to be embarrassed about. So if you're thinking that if you were to reach out and come to Epic Behavioral Health Care, that if they discover what your history is, that they're going to treat you differently, that's not going to be the case. They're going to be ready and willing to help you to try again.
Absolutely. It's a very nurturing environment. And if I could just add, Brian, it's very important for the generation that we're speaking to today to not be shy about seeking help. I often think, as a nurse myself, I took care of many people who were aged, having orthopedic procedures, having surgery, placed on very heavy narcotics post-procedure, and they have an addiction issue now, which, we all know about the opioid crisis.
Mm-hmm.
And I often think about when I worked at the hospital, we would see frequent flyers, if you will, of people who were falling at home often and rescues being called out 7-10 times a week. Do we ever ask them, are you on any substances that we can help you with? So I think nobody's at fault.
Mm-hmm.
Nobody asks to have an addiction
Right.
issue. It is a disease, but we can help. And that's why I really wanted Medicare Part B, so that we could really start to help serve those who, without knowing, ended up with an addiction post a procedure.
Mm-hmm. Well, one of the things that I've learned from you and getting to know you is that your motto is there's a solution for everything.
That's right.
Yeah. And so as you think into the future, right, as you're leading this organization, what are some things that you're hoping to accomplish? Like maybe you don't have a solution right now, but you're hoping to have a solution for in the future. What is your dream big list for your organization? Kind of putting you on the spot because I know it's a question I didn't give to you in advance.
That's okay. I'll have to think about that for a second. To be frank, I think top of mind is sustainability of what we do, sustaining our mission and our vision, and to continue to provide ease of access to care through our growing population.
Yeah, that's great.
Yeah,
that's one of the challenges that we have as well at Council on Aging. I mean, St. Johns County continues to grow. People continue to age. And so, I mean, right now, last that I checked, about 27% of our population is 60 or older, and that number is just going to keep going up and up. And like we serve thousands of seniors annually, but we're still just scratching the surface. There's still a lot more people to serve. All right, well, that music means it's time for our show to end. Nancy, thank you so much for being here.
Thank you for having me, Brian. I enjoyed it.
Everybody, thank you for tuning in and listening, and we'll see you here, same place, same time, on WFOY 102.1 FM. See you next week.